Dentistry is in a slightly different position to the rest of the NHS in the sense that it's moving to national commissioning, which we welcome. The current NHS contract is a very challenging, not very patient-focused contract in our view. So we are very supportive of what the government and the Health Secretary are trying to do. We generally, the initiatives that the Secretary of State are putting in place are welcomed by those of us that work with PCTs and SHAs. They've been quite a long time in coming. They're needed. Obviously there are a few wrinkles to sort out, and these are important wrinkles because this is healthcare. So the challenge really for us is to be ready when the changes come, and also to feed in particular ideas in the detail to make sure it ends up being good for patients.
How are you coping with that speed of change?
Well, dentistry actually is on a slightly slower burn, and we would advocate faster change in dentistry at the sort of pace is happening in the rest of the health service. The government has announced a new pilot for a dental contract based off registration, oral health care, and allowing patients freer access to the dentist of their choice, which is exactly the way that things should move. We've actually been leading the way in some contracts like that in various parts of the country. Really our call is that things move in dentistry at the same sort of pace as the rest of the NHS. So we're getting ready for the change, embracing it, and frankly hoping it moves a little bit faster for us as well.
What about the rest of the dentist population? I mean, how supportive are other dentists?
Dentistry has broadly been against changes in government policy over time. I can't speak for dentists overall, I'm not a dentist. Cautious welcome to the new policies is the best way to describe it, which is probably the best you can hope for in dentistry. I guess generally they might prefer slower change. We prefer faster change because we think it'll be good for patients. But I think there is a positive expectation, which is extremely good, because dentistry, whilst it's a subsector of provision, is an important subsector, and not enough people can get to a good dentist.
So the advantages to patients are fairly obvious, but what are they?
Well, simply put, the current system measures the number of treatments given. That doesn't encourage a focus on health prevention. It doesn't encourage registration, which is something which patients feel is very important. Not everybody wants to go to the dentist or needs to go every 6 months. They do want to feel that they're associated with a practice. And this new system, if implemented as promised, would give that. And we have programs that do that and are working. And I think the Secretary of State has got that vision and is leading towards it. So I think it'll be very good for patients. Yes, it involves quite a lot of change, but I think there is enough wrong with the current system. The change should be welcomed. I hope also that it will make a little bit clearer the link between private and NHS provision, because there are finite funds. Everybody should be able to have good access to good NHS care, but there are lots of options which frankly can only be made privately, and I'm hoping that the government will also make clearer those distinctions so that choice is embedded in the new system. So I think there's a few more things to work through, and the sooner the better.
And do you welcome competition?
We absolutely welcome competition. I think it's very simple. In most parts of people's lives, they enjoy competition. The Secretary of State's made it extremely clear that he's putting in place rigorous failure mechanisms so that within competition you can't have, just as you can't in say water companies, failure which leads to lack of service or poor service. This is healthcare, that's absolutely right. With the right regulator, I think he's putting monitor in place to do that, there should be completely open choice, and patients should be able to choose a dentist of their choice, not have arbitrary quota systems choose where they go. It's very straightforward. That would be the right way to do things. We think, by the way, we'll do very well in a system of choice because our quality of care is, in our view, extremely high. And other regulators like the CQC will help determine that. So we think competition is clearly the way to go with the right safeguards